Okay, we're going to talk about contusions now. In all probability, common bruises and contusions are the most common sports injury. Contusions are typically characterized as being associated with pain, stiffness, swelling. You get the ecchymosis, that purple color that comes up, and hematoma, which is bleeding underneath the skin. Okay? If not treated properly, such injuries to muscle tissues can result in a condition known as myositis ossificans. Once again, if you don't get the blood out of that area, it can calcify. And you don't want calcium deposits where you have a contusion. There's a contusion to a thigh. Who knows what that's from? Could be getting hit in football. This is an older married gentleman. It could be from just falling or dropping something on his hip. Dislocations. Dislocations have been defined as the displacement of a contiguous surface of bones comprising a joint. Excuse me. Basically, that's when the bones of the joint completely separate. So you have a dislocation, comes all the way out of the joint. Two types of dislocations can occur. First is a subluxation. It takes place when the bones of a joint are only partially displaced. So it may only come out part way, but that's called a subluxation. Then you have a luxation. It happens when the bones of a joint are totally displaced. It means they come all the way out. So there's two types of dislocations. Subluxation, which is a partial dislocation, and the luxation, which is a complete dislocation of those joints. No matter what type of dislocation occurs in the athlete, this should be viewed as a severe sprain. No matter what type. So it still is going to sprain the joint severely. Okay, next few pictures are fairly graphic, so watch and let me show you some things. Obviously, this is a dislocated finger. It's come out of the joint. You have to put those back. See those? That's fairly common. It's a dislocated shoulder. It's what we call a, now that I want to say it, I can't say it. But this is a dislocation of the shoulder, but what you can see here is the acromion and the scapula coming up right here, but you notice that there's a big gap here, and then here's the top of the humeral head. It's fallen down. Okay? So you see that joint, so that's a dislocation right there of the shoulder. Here's a dislocation of a kneecap. Here's the kneecap over here. And here's the knee over here. So that is a complete dislocation of a kneecap.